I first also want to begin by thanking staff, both for my staff, Senator Sanders' staffs, but all of your staffs as well. Y'all, we've worked really hard. They've worked even harder. And I just want to thank them because I think we're going to come up with a product that, that although last week revealed how sausage is made, and it was pretty messy, on the other hand, the final sausage is going to taste pretty good, to pursue the metaphor. We've worked on a bipartisan solution to lower cost. I can say that lowering the cost to families of drugs, prescription drugs, has been a bipartisan concern. And this is our mission. We're here to lower healthcare costs to improve access to the best possible care for fellow Americans. And the legislation we're considering today to reform the rules that govern PBMs and generic drugs does that. Now, PBMs have been criticized for their role in contributing to higher costs of prescription drugs, and they are a major player. Middlemen between multiple parties, employees, patients, pharmacies, manufacturers, and others. And the current concern has been if they've used this position as middlemen to pick drugs that serve their bottom line and the patient and the sponsor pay. But I can say, I have no doubt that the people who run those companies are well-meaning people. And in my years in the medical community, I've learned that there's far more bad incentives driving bad behavior than bad actors. And those incentives are things that we're attempting to address. The profit motive has played a major role in the creation of numerous life-saving drugs, but a market without transparency is dysfunctional. Patients should know what they're expected to pay, and employers have the ability to shop around for the best deal. Today's PBM legislation is at its core about improving transparency. One thing that we haven't really talked about, but one of the provisions in here would actually have a cover sheet when you get a mortgage. And you get a mortgage that tells you what your principal is, what your interest rate, and how much you're going to eventually pay for interest. We have that kind of enabled here. So the small business that doesn't have the ability to afford a third-party auditor can look at that cover sheet and get a sense. I can compare this plan to that plan to that plan, just as I can compare a mortgage from this bank to that bank. A real shout out to Kevin Schulman, a Stanford MD who works on all this. It was his suggestion, and it's just an example of how Americans around the country have kind of taken an interest in this and pitched in to make our product better. And so we've got multiple drugs that are going to speed lower cost generic drugs coming to market to prevent gamesmanship, to prevent abuse of the citizens petition process, to speed generic drugs to market by preventing the parking of 180-day exclusivity, and to change the orphan drug exclusivity to align with the scope of FDA approval, which would allow more drugs for rare diseases to come to market. You know, our colleague Angus King once said, there is no silver bullet when lowering the cost of prescription drugs, but there's silver buckshot. There is a lot of buckshot in this bill. And the solutions we consider today are examples of how we can lower drug prices without threatening the incentives to produce the life-saving drugs of the future. I thank Chair Sanders and the rest of you for collaboration, and I look forward to today's markup.